The content of this video is the sole responsibility of the speakers in this video. It is not endorsed by the group, nor by the PCFA with which the group is affiliated. See something interesting? Ask your doctor about it.
Are you a man with prostate cancer? Do you want to understand your disease so you can talk sensibly to your doctors? You're in the right place. So am I. I've tried to understand Gleason score, how it works, what it means. In this short video, I'll show you what I've come up with. I'm not a doctor. I'm just a man with locally advanced prostate cancer. Doctors sometimes use simple terms to explain to men how aggressive a prostate cancer is. For a cancer that does not present much of a risk at the moment, I have heard grumbling, low grade, indolent, well differentiated, lazy, and pussycat. At the other end, for high-risk cancers, I have heard galloping, high grade, active, aggressive, poorly differentiated, and tiger. These are often presented as pairs: lazy, active; indolent, aggressive; low grade, high grade; well differentiated, poorly differentiated; and a favourite with many doctors, pussycat, tiger. Doctors needed a clearer way to tell each other how aggressive a cancer is. That's where Dr. Donald Gleason comes in. Many of my audience will be familiar with this, so I'm going to make it a little quiz, like the TV quiz show QI. OK, contestants, hands on buzzers, no conferring. Our first question: what is the highest Gleason grade? If you said 10, you can stand up and take a bow. Now, if you took a bow, I guess you don't watch QI. QI is full of tricky questions where the answer most people would give is wrong. The screen flashes black and a klaxon sounds, which I simulate now. Because there are only 5 Gleason grades. When your pathologist looks down a microscope at your prostate cancer biopsy samples, cells that are neatly built and well packed get a Gleason grade of 1. Cells that are less neatly and less well packed get a Gleason grade of 2. Cells that are still recognizable and loosely packed get a Gleason grade of 3. We're getting into cancer territory now. Cells that are barely recognizable and starting to get messy get a Gleason grade of 4. Cells that are really messy get the maximum Gleason grade of 5. The tricky part of my last question was that I said Gleason grade. Some people thought I said, what is the highest Gleason score? Your Gleason score is made up by adding 2 Gleason grades for 2 different groups of cells. Now a chance to redeem yourselves. Look at this quite messy picture of a slice of someone's prostate. What do you think might be the Gleason score here? If you said 10, stand up and take a bow, if you dare. Here it comes again. Now I did say Gleason score, so it could be anything up to 10. But I did try to mislead you by saying messy. This is a perfectly healthy prostate. The cells have clear cell walls, and the packing is as neat as prostate cell packing gets. Choose any group of cells, and you get the top Gleason grade of 1. Choose any other group of cells, and you get the top Gleason grade of 1. The Gleason score is Gleason grade 1 plus Gleason grade 1 equals 2. We'd usually say Gleason score 1 plus 1 equals 2. If you got that right, I'm impressed. This next prostate cancer slide is stained a different colour with some dye. Again, we're looking for Gleason's score. I'll give you a bit of a hand with this one. First, I'll divide it into 2 groups. Then I'll tell you that because the cells on the right are fairly well formed, we can see the cell walls and the white bits in the middle. This side has a Gleason grade of 3. On the left side, the cells are pretty messy, but not as bad as they can get. This side has a Gleason grade of 4. Now you know, you give the answer in the form of Gleason grade plus Gleason grade equals Gleason score. What's your answer? If you said 4 plus 3 equals 7, take a bow, etc. But again, I have misled you. I only told you half the truth about Gleason's score. I said Gleason grade plus Gleason grade equals Gleason score. The whole truth is the Gleason score starts with the commonest Gleason grade, then the next most common Gleason grade. Gleason score equals commonest Gleason grade plus next commonest Gleason grade. So, as the biggest area is grade 3 cells, the Gleason score is 3 plus 4 equals 7. That's the end of the tricky QI questions. This test is for real. Again, we're looking for the Gleason score. Again, it will be in the form of something plus something equals something. Again, I'll separate the different grades. The smaller group on the left is quite messy, but not sloppy. I'll tell you it's a 4. The larger group on the right is really sloppy. I'll tell you it's the maximum grade 5. I'll remind you that Gleason score equals commonest Gleason grade plus next commonest Gleason grade. What's the Gleason score of this sample? Well, commonest 5, next commonest 4, Gleason score equals 5 plus 4 equals 9. Now the hardest part. What does your Gleason score mean? You're going to have to ask your doctor about this. The first reason is that I'm not a doctor. The second is that the doctor uses many things beside the Gleason score. Your doctor considers many factors. Where the cancer is located in the prostate, how large it is, how it feels to the doctor's finger, what can be seen on scans, your PSA history, other blood tests and clinical observations, your age, general health and fitness, and so on. Your doctor will bear in mind a man with a high Gleason score cancer may have a greater risk of spreading locally, of the cancer spreading to other parts of the body, and of not surviving prostate cancer. So, considering Gleason's score with all those other factors, your doctor may recommend more aggressive treatment for a high Gleason score cancer, or less aggressive treatment, or even active surveillance for a lower Gleason score. Just in case there is a newly diagnosed man with an aggressive cancer, say Gleason 5 plus 4 equals 9, listening to this, who is wondering whether he has 2 weeks or 2 months ahead of him, it may help you to know this. My prostate cancer was large. It filled the right side of my prostate. It spilled onto the left side. It was growing through the wall of the prostate in 2 places, including up and around a nearby organ, the seminal vesicles. The Gleason score of 6 out of 6 of the biopsy samples on the right side was 5 plus 4 equals 9. In all, a large, locally advanced, aggressive cancer. As I make this video, that was more than 5.5 years ago, and my PSA is currently undetectable. So don't panic. If you are a man with advanced prostate cancer, locally advanced like me, metastatic, that is spread to other parts, or recurrent, returned after your first treatment, there is a group of men helping each other understand the disease. The Advanced Prostate Cancer Support Group offers information and online forums at gymgym.com. That's the word gym 4 times, no spaces, .com. Nothing else, just .com. gymgym.com. Thank you.